BCTV is brought to you by Blascone, Color Your World.
Okay, so my name is Katali Estaloy. I'm the Managing Director for African Community Center for Social Sustainability, Access. We're in Nakaseke. Yes, in Access, we are a social impact organization that looks at community problems together with the community members, and we look at education, health, and economic empowerment problems, including environmental conservation. So with Access, our model revolves around the community health worker. We don't do anything that the community does not endorse. So we look at the community health worker who bridges the gap between us and the community. They inform the community on our initiatives that are ready to go there, and they also inform the organization on the possible problems that need to be solved in the community. So as the organization, we don't do it alone. We do it with so many people, both local and international. So our mission is to work with vulnerable communities through education, health, economic empowerment, yes, to create change that is owned by the entire community. And we dream so big. So it is health and wealth for all. We believe that everyone at time T will be healthy and wealthy, but it cannot be unless we all work together. So being the 8th month, the organization actually also maintains and works within the health fraternity. We maintain a clinic, we have an outreach program. The role, also reason as to why this organization started was actually to look after people with vulnerability, and basically was HIV. It's just that the vulnerability has extended, but we run the clinic, we take care of those people. We do not only look at the community in one perspective, it is a holistic approach. We look at the children, we look at the grandparents, we look at the elderly people, the women, and we also look at everyone that is within the community. So in order to address or approach our mission, we've come up with different strategies to solve the education problems. We have the nursing school. We have Access School of Nursing and Midwifery that trains nurses and midwives at the level of certificate and diploma. We also have the preschool, the Access Our Childhood program, our childhood development program, that is supposed to give a foundation for our babies in the community. We also have the OVC program, the children that are supported through education and scholastic support. So for health, we have the Static Clinic, which is Life Care Center. We also do the outreach programs. And for economic empowerment, we have the community women that maintain VCLS, they call the village saving schemes, that are supposed to empower women in their saving culture and teach them the spirit of saving and invest for the future. Yes, it is a span of activities that we do. In a nutshell, the mission actually speaks it out. As the organization, we began actually looking at the problem of HIV. In 2002, the level of stigma was really high. It was really hard to mix with anyone with HIV in the community, but as the organization, tell it or not, the organization has done a lot. It has walked a journey from 2002 to today, bringing in non-stigmatizing activities like drama groups, like solicitations into speeches, group public addresses, to also creating these VCLS, people working together and making meaning to one another, bringing in comfort and happiness amongst these groups to know that there's life after, thus living positively with HIV. It has helped the organization, and it has also empowered the community economically because there's will to work. Usually annually, the organization evaluates its mission drivers, and from 2002, the problems that have continued to face the community that the organization has tried to solve together with the community members still remain the health problems, which is long distances to health centers. We have long distance to health centers, we have self-medication, people are opening up so many drug shops and people are self-medicating. We have actually very low self-will to health care. And the organization has also come up with different initiatives towards that. In education, we have so many school dropouts. So many girls are dropping out of school due to pregnancy or economic times due to poverty. And for economic empowerment, people have less self-will to work. They grow their things in the community, they do a lot of farming, but the poor farmer collects very little in the community, simply because there are no supporting systems to empower them. Some of them are available, but they are not enriching to all community members who need to be served. Under environmental conservation, we have a huge problem. People, because of economic problems, poverty levels being so high, people are cutting down the trees to use them for firewood, to use them for charcoal for sale, and in so many ways. But the organization has also come up with different strategies to ensure that deforestation is cut down by planting trees, by creating jobs that are eco-friendly, ecosystem-friendly, like briquette laying, briquette making. The future of Access is really bright. Our vision is big. We envision health and wealth for all. We envision that every person is going to contribute to sustainable economic development. We envision that every person is going to have economic soundness in their pocket so that they can be able to take care of their children, their families, themselves, and the entire community at large. We envision a community that is supportive, community that is working together, and a community that is domineering towards economic sustainable development, but with the fruits made by themselves. The organization is 65–75% running on donations from people like us and our friends and organizations abroad that would love to support this mission, but also the organization struggles to have the community pay back to the service that is being given to the community. So even in the VCLs you see, as we support the VCLs to grow, we commission them and commit them to at least support about 10 children for school fees. They happen to be their children, they monitor them, they evaluate them, they make sure that they go to school and the quality is achieved. The vision is beautiful. It was a stone cast to spell out so many fruits. As we see a vision that was started and the initiatives that have been put in the community have been an initiation and a ground of people who believed. So Dr. Kalie Subula is a person who has enriched himself in love and support for the community, because he himself is a product of love and support from other people. So him working together with the community brings out the vision that is so attractive to anyone to embark on. It has attracted people like me, it has attracted so many other people, and as we speak, we have a capacity of so many community health workers, about 150, and structured to 250, supporting the vision. We have a structure of employees who come willingly, even those who leave come back, because the vision is big and still moving. As someone who is a social impact influencer, I would love to appeal to the rest of Ugandans to have the spirit of giving, spirit of love, spirit of spirit of love, and the spirit of willingness to support and to be a part of something that is shining and contributing to community success. So as Ugandan and African communities, it has not been so easy and evident for people to give willingly unless they are asked. But I appeal to every Ugandan who would love to extend this vision elsewhere to do so, and those who want to join this mission to also support. But those who cannot support the vision directly and want to indirectly go to their own communities, they're welcome to come and learn from the program. I want to take this opportunity to thank the Almighty Lord who has enabled us to go this far. It is not an easy flow. I also want to thank the President, Dr. Robert Kalie Subula, for his support and commitment to this, the senior leadership of Access, Mr. Sewanyana James, one of the directors of the organization. I would love to thank the higher board of Access, chaired by Dr. Semitala Fred, and all other governing councils, like the school governing council that is managed and chaired by Reverend Mwanda Michael. to reach to the program and be in anyone who would want to be part of the program and also share with us in this vision and mission, you can reach me on 0782 34 85 60. That's my WhatsApp number. I send Christmas greetings and the message and love of our Lord Jesus Christ to everyone there who has supported one another, who has loved anyone else within the neighborhood apart from themselves. We wish you a Merry Christmas and many more years to live in the celebration of Christ.
I'm Dr. Kalyesura Robert. I'm a president of the African Community Center for Social Sustainability. Thank you very much for having us today and visiting us in the community with the work to do. Access is a community-based organization founded on the virtue that everyone has a right to good health and good wealth. So that's what we follow, and we work through a lifespan from a time the lady gets pregnant, children are born. We have the early primary school. We support orphans and vulnerable children. We also support those who are not able to continue with the formal education through the nursing school. And we also have programs that empower young girls and young men. I feel very happy and excited, but this cannot be about me. It's actually the numerous individuals that have made this possible. First, the local people who contributed to the vision at its start. We are rooted based in the community health workers, and then the management team at Access, which works tirelessly to ensure that all the works get done well. And then the local partners, the government, the hospitals we work with, and then our donors and sponsors who are able to work with us and support the work that we do. So really, during the AIDS month, we celebrate the people who have come out positively to contribute to making sure that we end the pandemic of HIV/AIDS. But also, more importantly, we value those who have come out positively and continue to mourn with those who are affected. But we know that the end is not very far, and so we continue to spread that message of hope, ensuring that we stop the spread of HIV. The best thing about HIV, because it currently has no cure, is never to get it. So the best message, try as much as possible. We have now have many advanced technologies, including an injection you can take only twice a year. So try as much as possible to ensure that if you don't have HIV, you don't get it. For those who have it, please ensure that you take the drugs and adhere to the treatments that have been given to you, but also make sure that you don't spread the infection to another person, because you know that having HIV never leaves you the same. So since the inception, of course, our basis was supporting people with HIV. We support HIV, people living with HIV through the medical care, home visits through our community health workers. We have a clinic that supports them. We work with the government to ensure that those who need ARVs get them from Nakaseke Hospital. But also for those who are in their homes, we actually visit them, support them with different goodies that they need to live a wealthy life. And also we support the aftermath, those who are affected by HIV, who are our main interest, the orphans and vulnerable children, through giving them school fees, giving them textbooks, but more importantly, having social workers that ensure that the child grows up wholesomely, because some of them have no parents, so Access becomes their parent to make sure that they take care of them through their life and ensure that they grow up to be useful human beings to this world. For people with HIV, the services are actually free, but for the community, they do a small cost sharing to keep the programs running. We have a few income generation projects, but largely we depend on supporters, and both from Uganda and outside. Our plea would be that more Ugandans get interested in this and also continue to lend a hand to their fellow Ugandans. So I want to thank the UBC team for having given us this opportunity to celebrate this month of HIV/AIDS, but also more important to celebrate Access Uganda. I want to send greetings to my family my wife, my children, my other relatives, and I wish them a Merry Christmas and a Happy New Year. If someone wants to reach out to me, they can reach me out at 0704 442 700.
My name is Asowanyana James. I work with African Community Center. I met Dr. Kalie Subula 20 years ago, and we worked together for some good time. And then later on, we picked interest in our community. We found in Nakaseke community with a lot of problems. That's how we identified some families, and we decided to start a community-based organization, and that's how we started helping our community. I think we have achieved our goal. When you see where we started from, our community was really very bad. We started the HIV clinic and the community engagement when there was no art in the hospital. So we were treating people for opportunistic infection. We were supporting them, and we were giving them memory books so that they make like their wills. But now when we see where we have been and where we are now, we have moved a long way, because now we are empowering the community, we are empowering the families who had lost hope. So we are very glad to see now there is a big change in our community. People with who are living with HIV access medication from the government facilities. But for other opportunistic infections, access with other partners try to intervene. The beauty of working with the community is when you see that you are achieving your goal. I appeal to all Ugandans to come up, those who have enough to support the others. Let us work together. Let us support our community to make sure that Ugandans are okay. I wish a Merry Christmas to my family, my wife and children, my co-workers, my friends and our partners. Thank you very much. Now, I want to take this opportunity to take you through the number of beneficiaries who have benefited from access since we began. I'm taking just a few of them, but there are so many.
Amanya gange nze Nakafeero Maria. Access eyina kyennyambye kubanga ekutte ku mwana wange omuzzukulu emuweerera. Ate nange mpa ku buyambi okumanya access. Nina mutabani wange yanfaako. Kati bwafa tumala okuziika. Yafa accident. Kakati bwe tumala okuziika twabuka. Waliwo omwami bamuyita Migadde. Ndowooza kale oba yali mukwano gw'oli mutabani wange omugenzi, simanyi nange. Kati yajja wano nga nnoonya. Waliwo omukyala gwe yajja naye bamuyita Lesite. Kati bwe batuuka eri abaana wali awaka ne bababuuza abaana abaali wano baalagawa abaana b'omugenzi. Ne babagamba bali wa jjajja. Kati nagenda okulaba ng'omwami oyo azze wano n'oyo omukyala. Nangamba batulagirira abaana b'omugenzi ko nzinze mbayina. Ne baŋŋamba kaakati katutwaleko omwana omu tumukuyambeko tumuweerere. Kati bwe bityo bwe byajja.
I'm Kigozi Frank Seriso, born in Nakaseke district, Kasaga parish, Gangu village. That is my home village. My mom, she's called Gwariwa Harriet. I'm living positive life, and she also living a positive life. I was born with a virus that made me to be positive living, but I started my art or my treatment in 2009 in Chioko Hospital, But to cut the story short, I came back to Nakaseke Hospital. That's to get my treatment, because going to Chiwoko was a little bit long journey. So they gave me transfer to come back to Nakaseke to be receiving my drugs there. So when I was a patient in Nakaseke Hospital, Access came in to look when they were looking for the vulnerable children. So they rendered on me. After interviewing me, find that I'm eligible to be enrolled on the program. After asking me some questions, like to check whether I'm eligible for the program, luckily I was among those who was eligible to be enrolled on the program. That was 2013. I recommend about it because by the time they enrolled me, I wasn't able to attend school. But after being part of the program, they were able to provide me all scholastic materials and school fees. They used to pay school fees to zero balance, providing scholastic materials, that is books, pens, bag, uniform, and shoes. They paid for me from P3 up to tertiary level, where I did a medical records as a course. I finished it in 2022 at a school called Makere Business Training Center in Bwaise. After finishing my certificate, I came back to Nakaseke Hospital to start to volunteer as a medical records assistant. While volunteering at Nakaseke Hospital, an opportunity came in whereby there was an organization called Uganda Initiative for Uganda, UINCD. They were looking for data personnel. So I wrote my application. After writing my application, I was among those who were shortlisted. I went for an interview. Luckily enough, I passed the interview and I got the job. My message to those people who are living positive out there, not only Uganda, but world at large, living positive life doesn't mean it's the end of life. As far as you take your medication well, you care yourself, you chase out stigma in you, you can live, you can chase your dream, and you can achieve them. Those who are negative, I encourage them to maintain their health, to practice all strategies that are put in place by the ministry to stay negative, like taking PrEPs, putting on condom, and those who are in schools, please, they can still wait for sexy or to engage in the activity that can cause them to acquire AIDS. I send greetings to my mom, my brothers and sisters, even Access family. I send greetings, plus the hospital where I work, all that stuff. I wish my workmate Merry Christmas and Happy New Year. Thank you.
Amanya gange nze Gertrude Nalujja, nkolera mu kitongole kino ekya Access. Omulimu gwenkolamu emirimu giri mingi, naye okusingira ddala nkola mu community. Tulabirira abaana abo ba orphans and vulnerable children, tubawa ebitabo, tugenda ku masomero okubalambula, tugenda eka ne tubalaba, awamu n'okulabirira ebisolo bye baliko bye balunda buli kiseera. Okusoomooza kwenandisinza okweninga kwe ŋŋamba galinganga makubo, naye nga sofa kyo ekitongole kyaffe kitukoledde ebintu byonna ebyetaagisa, kebeere enkuba, kagubeere musana, transport yaffe ekola ki? Ebeerawo. Okusinziira kuva waggulu ku mukama waffe Pulezidenti, engeri gye yajja mu kitundu kino ng'akola mwoyo gwa ggwanga, nange kyampaliriza okubeera nti bwe mba nkola nga nange nnyongera ettaffaali ku bantu ba Nakaseke okubeera obulungi. Nsooka okutumira abakozi baffe bonna ab'omu kitongole kyaffe ekya Access ntumira mama wange Karen Naskombi awamu ne baganda bange ne abaana bange bonna mbagaliza Christmas ennungi n'omwaka ogujja omulungi.
Kakazi Juliet Access nagimanya ku byonna kunzijanjabira omwana nga nemeredde yali atuuse ku ssaawa ey'okufa ng'era essuubi limaze okunzigwamu naye Mukama bwe nakwata ekkubo n'entuukayo ne bambeererawo bonna ne bafuuka abazadde ab'emisana n'ekiro ne bamulongoosa mu bulago ne bamujjanjaba benna yali aweddewo era batuwa bulungi buli ddagala batujjanjabira bwereere kye neetaaga bwe mba nina ekinnemeredde nziruka ne ŋŋenda ne mbagamba baafuuka bazadde. Omwana yasooka n'alwala okutu ng'engeri y'akatulututtu n'akatakula wano wonna ne waggwawo yenna n'afuuka amabwa ne ŋŋenda mpaka eyo nkozi wa Nakaseke yonna ne bigaana kama nantemera ekkubo ne ntuuka ku Access ne bamujjanjaba era bamuweereza eddagala nga liva special Kampala.
Amannya gange nze Tugwinayo Edwin era mbeera Nambega. Neebaza ekitongole kya Access okunkwatako okuva we nalwala obulwadde obwa HIV n'okutu okwali kunfuukidde ekizibu ne bankolako ne bantwala yonna ne banzijanjaba era mbasabira Mukama abawe emikisa kyonna ekitongole.
My name is Nakafero Florence. My role, I'm a VHT for that CBO Access, and purposely my work is to identify such activities. Now we have been interviewing the OVC. It is my role too as a VHT to identify those vulnerable children to show them to the community. But currently, I was empowered to be a lead for women economic empowerment, because Access does everything. Deals in youth, deals in children, deals in women, and other activities. I've learned many things, because as Access is dealing with three major things, that is education, health, and economic empowerment. So I've learned a lot when we were practicing as a VHT in non-communicable diseases. I did patient education to community members of Nakaseke, such that these people should handle their life carefully. And as well, I couldn't teach only people, but I also practice it. So I changed my lifestyle to prevent those non-communicable diseases over my life.
I'm Naukenya Jacqueline. I work as a social worker here at Access in Nakaseke. My work is to support all the OVCs, the vulnerable children and the orphans, and we are here in the community. We reach out to them, we give them scholastic materials, books, we pay school fees, buy them bags, uniforms. We also reach out to them, we give them animals, we give them pigs, we give them goats, so that they can be economically empowered, because we can reach a certain extent where we cannot support them, but when they have these animals, they can rear them, sell them, and then earn some money. We also have groups, visceral groups. We support them. We give them, we economically empower them. We economically empower them in briquettes. We do bookmaking. We have apiary groups, and we normally support them. We have a lot of activities that we do in the community. Some of them we are limited by finance, but we have them. We have very many groups. We have very many children. We have very many women that are vulnerable, women with HIV that we support in groups. We wish to wish the Access team a Merry Christmas and Happy New Year. My children in communities, the OVCs, my parents, Mrs. and Mr. Matovu, my sisters and brothers, my community team, and everyone at Access. I wish you a Merry Christmas and a Happy New Year.
In a nation hungry for truth, a world where every story matters, there exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world.